Plastic surgery is a booming business all year long. Maybe you're toying with the idea of a little touch-up, but are terrified of getting the wrong results. Well, Dr. David Goodkind is here from Fusion Medical Aesthetic Boutique in Brantford to show us the good, the bad, and the best. Good morning to you. Thank you for coming in.
Good morning. Thank you very much.
So, first of all, people hear the word plastic surgery and often they get scared right off the bat. Oh, it's going to be drastic and I'm going to change the way I look and it's going to come out all wrong. What is your idea of what plastic surgery should really be for your patients?
Well, plastic surgery really should be a very gentle rejuvenation. There's nothing wrong with having plastic surgery, but if done properly and nicely, you shouldn't have any of the signs of having anything done. You should be able to go out on any given day without makeup if you're a woman and look as good as you could possibly look. A very gentle, nice, soft transformation.
And we always think, okay, if anyone can get it done right, it's going to be the celebs. They have all the money in the world, they have access to the best doctors, but sometimes they're the worst examples of plastic surgery. We're going to start with some celeb pictures of liposuction. Tara Reid, what is going on here? First of all, I think she looks phenomenal on the left-hand side, and that's the before picture.
Correct. Well, what happened here was she had liposuction. Liposuction is a great operation, but it's a great operation in the proper selected patient. She was not a
What were they
proper
sucking
patient.
out? I mean, she's got a beautiful flat stomach.
Liposuction should be done for areas of isolated fatty deformity.
So if she had, say,
contour.
a real apple body or something, maybe a little bit of lipo to...
Here they just tried to circumferentially or around her entire abdomen reduce the thickness of her fatty layer, which she didn't have much of to begin with, and their assessment was such that she would look good. She doesn't. They removed her volume. Volume is either skin, muscle, or bone, and left her envelope, her skin envelope, to retract back, but it didn't. So she traded a rather attractive abdomen for one that looks unnatural and terrible.
A little fat looks good, frankly.
Right.
There's
nothing wrong with that.
No. You just help us get it in the right place.
Right.
All right.
It has to be nicely proportioned.
And so these are some examples.
Here's an example of a good candidate, someone who has good skin elasticity. Here's another one, someone with good skin elasticity. We removed some of her volume, her skin envelope, and another one was allowed to retract back, and she has a very nice contour. Again, an isolated area of fatty disproportion that was removed and the skin retracted back nicely.
Gotcha. Yeah, these are much softer results. Okay, let's talk about lip augmentation. This was maybe is toning down a little bit, but everyone wanted the Angelina Jolie lips, and we saw stars like Meg Ryan. I think we do too. Here we go. So she has like that trout pout look. What happened here?
Well.
And oh my goodness.
Okay, Meg Ryan didn't have much of an upper lip. You can't augment something that's not there. So she has an unnatural upper lip, and then they enhanced her lower lip that then increases her disproportion. That wasn't nice. And so there you see, so now her upper lip looks abnormal, and now her lower lip is way out of proportion to her upper lip. The second example is someone who had nice lips to begin with, but again, they augmented them, increased the volume and size of her lower face. Her lips are okay, but doesn't match the rest of her face, and even the uneducated observer realizes that there's something wrong here. You have to keep nice proportion in order to be attractive. Attractiveness, aesthetic perfection is symmetry and proportion.
All right, and we lost it on that one. Let's show some good examples then of lips done well.
There you go. Here's someone who has modest lips. She wanted to be on the bigger side, and here's another one with modest lip. Your lower lip should be slightly bigger than your upper lip. You should have a nice contour. It should be even and nice, not like some of the other examples. A lot of the examples you see.
Yeah.
Terrible.
All right, nasal surgery. First of all, what is that? Are we talking rhinoplasty or no?
Rhinoplasty.
Rhinoplasty, okay.
Cosmetic rhinoplasty. Think of your nose as a tent. The bones and cartilage are the struts, and the skin is the canvas. In rhinoplasty, you tailor the bone and cartilage, and you let the skin redrape.
Okay.
So, if done nicely, it's a beautiful result. Michael Jackson had way too much done.
I liked his nose before, frankly.
There was nothing wrong with his nose before. Now he has a very unnatural, very thin, a terrible look for his wide face. It's terribly in disproportion, and a layperson would obviously realize that.
All right, facial surgery. So there's certainly lots you can have done here. This can be a really scary one for people because it really can drastically change where your eyes were and how your mouth sits and all that sort of thing. So let's look at some bad examples. There are lots of them. And this woman is famous, unfortunately, for her bad surgery.
Whenever you look at bad facial fillers, there's always a picture of her.
And poor Priscilla's so gorgeous.
Priscilla, unfortunately, had industrial-grade silicone injected in her face, which led to some inflammation and caused her huge lumps and bumps and disproportion.
And is that permanent?
That's unfortunately with her. A lot of fillers aren't permanent, but silicone is permanent, and there's nothing that she can do for this.
So let's look at better examples.
Right. It can be done with much more finesse. Here you see on our right a post-op volume patient. Her pre-op was on the left side, and here's another one. It's subtle. The best picture to see is the one on the extreme left, where you see on the top she's devoid of enough facial volume to give her cheek projection, and on the bottom left she has much nicer contour and proportion.
Super subtle. They just look like fresher, prettier versions of themselves. And that is the goal, right?
Less is more.
That is the goal. And there are more pictures at your website as well, which is fusionct.com.
Correct.
Dr. Goodkind, thanks for coming in.
Thank you very much.
Always fun to look at the photo books. All right, we're also looking at the weather today, Ryan. We're wondering kind of what's going on. Are we getting rain? It's pretty cloudy.
Nope.